6 exercises to do in bed that destroy deep abdominal fat after 50 years old. Before we begin, please leave a comment with your name and the city you are watching our content from. We would love to know. Exercise number 1, dead bug. After 50, the core stops being just about aesthetics and becomes about independence. It is the core that supports you every time you get up from a chair, carry a grocery bag, or play on the floor with a grandchild. And that is exactly why the dead bug opens our list today. Unlike what many people think, it is not a simple warm-up exercise. It is one of the most complete movements for activating the deep core without overloading the lower back, which makes all the difference when the spine is no longer as forgiving as it used to be. This exercise works primarily the transverse abdominis, the rectus abdominis, and the lower back stabilizers, while also requiring coordination between opposite arms and legs, which stimulates proprioception as well. To perform it correctly, lie on your back with your arms extended pointing toward the ceiling and your knees bent at 90 degrees, forming a right angle between your thighs and torso. Contract your abdomen by pressing your lower back lightly against the mattress and, in a controlled manner, extend your right arm back behind your head at the same time as you straighten your left leg, bringing it close to the surface without losing the core contraction. Return to the starting position and repeat on the opposite side. The extra tip here is to breathe in a coordinated way with the movement, exhaling during the extension of the limbs. This increases the recruitment of the transverse abdominis and prevents you from holding your breath, which is an extremely common mistake. Another frequent error is allowing the lower back to arch and lift away from the surface during the movement, which removes tension from the abdomen and places stress on the spine. If this happens, reduce the range of motion until you can maintain control. Start with 2 to 3 sets of 8 to 10 repetitions on each side, always prioritizing quality over speed. If you have an acute herniated disc or undiagnosed severe lower back pain, speak with a health professional before adding this movement to your routine, since any exercise involving trunk stabilization needs to respect your individual limits at this time. It is worth reinforcing why core training matters so much at this stage of life. It does not serve only aesthetic purposes, but mainly to stabilize the spine and reduce the risk of injury during simple daily tasks, such as bending down to pick something up off the floor or rising from a low chair. A strengthened core works like a true natural belt, protecting the lower back in virtually every movement you make throughout the day, even in those where you do not even realize you are using that muscle group. Exercise number 2, bicycle crunch. If there is an exercise that tends to divide opinions among people who train at home, it is this one. Many people associate the bicycle crunch only with the pursuit of a six-pack, but the benefit goes far beyond aesthetics. Electromyography studies have already shown that this is one of the movements with the highest activation of the rectus abdominis and the obliques among equipment-free exercises, making it extremely efficient when the time available to train is short, something common in the routine of those who already have decades of accumulated commitments. The movement simultaneously works the rectus abdominis and the internal and external obliques, while also requiring some endurance from the hip flexors. To perform it, lie on your back, place your hands behind your head without interlocking your fingers, and raise your legs to form a 90-degree angle at the knees. Rotate your torso, bringing your right elbow toward your left knee while extending your right leg, alternating the movement in a controlled manner as if you were pedaling in the air. The extra tip is to keep your elbows open and not pull your neck with your hands, since this is precisely the most common mistake in this exercise and can cause cervical discomfort, especially in people who already feel tension in that area. Another mistaken belief is thinking that doing the movement too fast increases the results. In reality, excessive speed reduces muscle recruitment and transfers the load to momentum, taking away the efficiency of the exercise. I recommend 2 to 3 sets of 10 to 15 repetitions on each side, gradually increasing as your control improves. If you frequently experience neck pain, an alternative is to rest your head and perform only the trunk rotation with your legs extended on the surface, reducing the demand on the neck. People with untreated abdominal diastasis should avoid this exercise until they receive clearance from a professional, since the rotational movement can worsen the muscle separation. Exercise number 3, leg raise. The leg raise is one of those exercises that seems simple on paper, but requires far more control than it appears to, especially in the lower abdominal region, which tends to be the most resistant to visual changes even in those who already train their core frequently. What many people do not know is that this region does not respond differently to training because of anatomy, but because it tends to accumulate subcutaneous fat more easily in a large portion of bodies, which makes the result of training take longer to show visually there. This exercise activates primarily the lower portion of the rectus abdominis and intensely recruits the hip flexors as movement stabilizers. To perform it, lie on your back with your legs extended and your hands resting at your sides or slightly under your lower back for support. Raise both legs together and extend it until they form a 90-degree angle with your torso, then lower them in a controlled manner without letting them touch the surface, maintaining constant tension in the abdomen. The extra tip is to keep your lower back pressed against the surface throughout the entire movement, controlling the descent of your legs for at least 3 seconds. An extremely common mistake is lowering the legs too quickly, letting gravity do the work, which removes virtually all tension from the abdomen and transfers the effort to the lower back, potentially causing discomfort in that area. Perform 2 to 3 sets of 8 to 12 repetitions, progressing first in the quality of control before increasing the number of repetitions. A more accessible alternative for beginners is to slightly bend the knees during the movement, reducing the lever arm and the demand on the lower abdomen. People with uncontrolled high blood pressure should pay extra attention, since exercises with prolonged isometric tension can temporarily raise blood pressure, making it advisable to consult a doctor before intensifying this type of training. One point I like to clarify is the difference between abdominal hypertrophy and abdominal definition, because this confusion creates unrealistic expectations. The leg raise and the other exercises on this list promote hypertrophy, meaning they strengthen and develop the musculature beneath the skin. Definition, that visible outline of the muscles, depends primarily on your body fat percentage, which is determined mainly by diet. This means that training the abdomen with dedication while neglecting your diet will strengthen the area, but will not necessarily make it visible. And understanding this difference prevents frustration along the way. Exercise number 4, oblique crunch. While the traditional crunch focuses on the front of the torso, the oblique crunch works exactly the lateral region, that strip along the sides that helps define the waist and that tends to receive little attention in generic workouts. I have observed that practitioners who include specific oblique work in their routine report more ease in daily movements that involve trunk rotation, such as grabbing something from the back seat of the car or turning quickly when someone calls your name. The movement recruits primarily the internal and external obliques, with secondary participation from the rectus abdominis. To perform it, lie on your side with your knees slightly bent and place the hand that is underneath supporting your neck or crossed over your chest. Contract the lateral abdomen by raising your torso toward your hip without pulling your neck, and return in a controlled manner to the starting position. Complete all repetitions on one side before switching to the other. The extra tip is to imagine that you are trying to bring your ribs closer to your hip rather than simply lifting your torso, since this mental image significantly improves oblique recruitment. A common mistake is using the momentum of the supporting arm to push yourself up, which drastically reduces the muscular work of the lateral abdomen and turns the exercise into something almost useless for the intended goal. I recommend 2 sets of 10 to 12 repetitions on each side, increasing the number of sets before significantly increasing the repetitions. If you feel discomfort in the shoulder that is resting on the surface, use a thin pillow under your head to better align the cervical spine. People with shoulder bursitis or recent injuries to that joint should avoid resting body weight this way and can substitute with seated trunk rotation variations using light resistance. Exercise number 5, side crunch. Unlike the oblique crunch performed on your side, the side crunch we work on here is done in the face-up position, with a focus on more intense and isometric recruitment of the oblique region, functioning almost as a bridge between dynamic and static core work. The beauty of this exercise lies in its ability to strengthen the lateral trunk without requiring a large range of motion, which reduces the impact on joints that may already show some natural wear from age. This movement activates the obliques, the quadratus lumborum as a stabilizer, and to a lesser degree the rectus abdominis. To perform it, lie on your back, bend your knees, and let them fall gently to one side, keeping your shoulders resting on the surface. From this position, slightly raise your torso towards your hip, feeling the contraction in the lateral region opposite to the direction of your knees, and return in a controlled manner. Complete the repetitions on one side before reversing the position of the legs. The extra tip is to keep your feet together throughout the entire movement, which helps stabilize the hip and better isolates the lateral musculature. A fairly common misconception is thinking that this exercise also intensely works the quadriceps because of the leg position, when in reality the role of the legs here is simply support and stabilization, not active work. I suggest 2 sets of 10 repetitions on each side, always prioritizing the sensation of lateral contraction over range of motion. If you feel discomfort in the knee resting on the mattress, use a thin cushion between your legs to relieve joint pressure. People with a recent hip replacement or diagnosed pelvic instability should avoid this exercise without first obtaining specific medical clearance. Exercise number 6, plank. We have arrived at the exercise that is perhaps the most well-known on this list, but also one of the most poorly executed. I confess that in my first years of training, I also used to count the seconds hoping the timer would freeze. So if you have ever done that, know that you are not alone. The plank is frequently treated as an endurance test, a competition to see who can hold it the longest, but that mentality is precisely what reduces its effectiveness. What really matters here is not the clock, it is the quality of the isometric core contraction during every second you hold the position. This exercise is considered one of the best for overall core activation, recruiting the transverse abdominis, the rectus abdominis, and the obliques, while also requiring isometric work from the shoulders and gluteus maximus as stabilizers. To perform it correctly, rest your forearms on a firm surface, aligned below your shoulders, and extend your body back while resting on your toes, maintaining a straight line from your head to your heels, without letting your hips rise or sag. The extra tip is to actively contract your abdomen by drawing your navel toward your spine, while also lightly squeezing your glutes, which further stabilizes the pelvis and protects the lower back. An extremely common mistake is allowing the hips to sag toward the surface, transferring all the load to the lower back region instead of keeping it in the core, which can cause discomfort and over time overload the spine. It is worth noting that a very soft surface, such as a very plush mattress, reduces stability during the plank. So if you notice difficulty maintaining balance, prefer to support yourself on a firmer base. Start with 2 to 3 sets of 20 to 30 seconds, gradually progressing to 60 seconds before thinking about more advanced variations. People with carpal tunnel syndrome or pain in the wrists and elbows, even when resting on the forearms, may feel discomfort in the shoulder and should stop the movement if they feel acute pain, seeking professional guidance for adaptations. Before we continue, do not forget to subscribe to the channel and turn on the notification bell. Having constant access to science-based information is what will allow you to progress with long-term health in the world of exercise. You have just learned 6 exercises capable of deeply strengthening your core, but there is one piece that almost no one mentions when the subject is reducing fat in the abdominal area, and it does not even involve the abdomen. Let us move on to the bonus exercises so you can understand that connection. Bonus exercise number 1, glute bridge. It is important to be honest with you here. The glute bridge does not directly work the abdominal muscles like the previous exercises, but it deserves a prominent place on this list for a reason that very few people know. The gluteus maximus is the largest muscle in the human body, and 99% of people do not know that. Strengthening the largest muscle in your body has a direct impact on your caloric expenditure, including after the workout ends, thanks to a phenomenon called excess post-exercise oxygen consumption. The larger and more active the muscle mass worked, the greater this effect tends to be, which contributes to the reduction of overall body fat, including the abdominal area, even without directly working the abdomen in that specific exercise. In addition, strong glutes impact the reduction of abdominal fat in other indirect ways. They improve pelvic stabilization, which reduces postural compensations that often lead to lower back pain and limit your ability to stay active throughout the day. A more active body with less pain and more energy tends to accumulate more daily movement, and it is that accumulated movement combined with a balanced diet that truly determines fat reduction in any area of the body, including the abdomen. To perform the glute bridge, lie on your back with your knees bent and your feet resting on the surface, close to your hips. Raise your hips by intensely contracting your glutes until you form a straight line between your shoulders, hips, and knees, avoiding hyperextending your lower back at the top of the movement. Lower in a controlled manner without letting your hips touch the surface between repetitions. Maintaining constant tension in the musculature. The extra tip is to pause for 1 second at the top of the movement, squeezing your glutes with maximum force before lowering, which significantly increases muscle recruitment. A common mistake is using the lower back to generate the movement instead of the glutes, which you notice when you feel more effort in your back than in the glutes themselves. Perform 2 to 3 sets of 12 to 15 repetitions. People with symptomatic lumbar herniated discs should exercise extra caution, and if they feel any pain radiating down the legs, should stop the exercise immediately. One extra note is worth making here. Many men neglect specific glute training, by associating it only with female aesthetic goals, and this is a mistake that undermines strength, athletic performance, and even overall aesthetics. Weak glutes overload the knees and the lower back in virtually any physical activity, so including the glute bridge in your routine is a decision that benefits the entire body, not just the area directly worked. Bonus exercise number 2. Lying abdominal vacuum. Closing our list with an exercise that seems too simple to work, but that carries decades of use in rehabilitation and physical conditioning programs. The lying abdominal vacuum is, in practice, an exercise of breathing and control, not of brute force, and it is precisely for this reason that it tends to be overlooked by those seeking quick results. This exercise activates almost exclusively the transverse abdominis, the deepest layer of the abdominal musculature, responsible for functioning like a true natural belt around the waist. Strengthening this deep layer directly contributes to a waist with a more defined appearance, in addition to improving spinal stability in any movement of daily life. It is worth remembering that the famous six-pack depends primarily on a low body fat percentage combined with developed abdominal muscles, and no isolated exercise, including this one, replaces a balanced diet in that process. To perform it, lie on your back with your knees bent and your feet resting on the surface. Release all the air from your lungs completely, and, at the end of the exhalation, draw your navel inward toward your spine, as if you were trying to press your abdomen against your back. Hold that contraction for a few seconds while breathing in short, shallow breaths through your chest, then release gradually. The extra tip is to always practice this exercise on an empty stomach, preferably in the morning, since active digestion can make it harder to fully contract the abdomen. A very common mistake is confusing this movement with holding your breath, when in reality the technique requires fully emptying the lungs before beginning the contraction. Hold the position for 10 to 20 seconds, repeating 3 to 5 times, gradually increasing the contraction time as you gain control. Pregnant women and people with diagnosed abdominal hernias should avoid this exercise since the increase in intra-abdominal pressure may not be recommended in those conditions, making it essential to seek medical guidance before practicing it. If you enjoyed this and want to discover the best exercises to address that stiffness affecting your mobility, we have a video appearing on screen right now showing each of them in detail. I do not see anyone else talking about this, so make sure you check it out. Thank you for watching all the way to the end, and may God bless you, my friend.